Hello, how are you? I hope you're doing well. There's something that about 90% of nurses don't really know much about. They simply kept pressing the Ambu bag all the way during CPR, which is actually incorrect. Let me share a few important points about the Ambu bag. First, when we want to ventilate a patient using an Ambu bag with a mask on their face, always remember that this valve must to completely close this so we can provide to maximum oxygen delivery to the patient. Second, if the patient is being ventilated through an endotracheal tube or an LMA, this valve needs to be adjusted. That does that mean? It means that if the patient is an infant, the pressure should be set to 20 centimeter HO, for a child 40 centimeter HO, and for an adult 60 centimeter HO. Why is that important? Because we deliver too much air into the lungs without proper adjustment, the patient can develop barotrauma or valotrauma, damaging the lung and making the CPR ineffective. So this valve must be properly set. If an excessive volume of air enters the lungs, this safety valve allows extra air to escape. That's actually a way it's called a pressure relief safety valve. Now think about this. A normal breath brings about 500 to 600 millimeters of air into the lungs. So during CPR, do we press the Ambu bag all the way down? In most CPRs, your nurse is doing actually that, pressing the whole bag will, and Ambu bag can actually deliver 100 to 1000 millimeter of air. So by pressing in fully, we're forcing too much air and oxygen into the patient lungs, which can cause barotrauma. You don't need to squeeze the entire bag with both hands. Using one hand gently compress just the upper part of the bag, that's enough. When used without an oxygen source, the Ambu bag provides only 21% oxygen room air. If connected to an oxygen line, it delivers around 61% oxygen, and if it's connected both to an oxygen line and a reservoir bag, it can deliver up to 90 and 100% oxygen. So you can see how important it's to use both the oxygen connection and the reservoir bag. These are the key essential points about the Ambu bag, along with some techniques that are vital in ensuring proper oxygen delivery. For instance, maintaining the correct head to neck position and choosing the right mask size for infants, children, and adults, Things I'll explain in detail in the next video. I hope these types were helpful for you. Share this with your friends so everyone can learn the proper use of the Ambu bag. Take care of yourself. Goodbye.